Hello, welcome to the Royal Voluntary Service podcast. I am waiting with eager anticipation for any questions you may have about men's health generally, but specifically about prostate problems, prostate symptoms, which are increasingly likely as men get older. But I'm happy to talk about any issues relating to men's health. Men traditionally don't talk as much as women tend to do about their worries about their health, their family's health. So this is a great opportunity for any questions you may have, anonymously or otherwise, to pose to me, and I'll do my very best to answer them. So would anybody like to get the ball rolling with the first question? Well, I shall start. Pauline has a question. What are the symptoms of prostate cancer? And this is really important because it's easy to think that the symptoms of prostate cancer might be different to those of simple prostate gland enlargement, which all men will experience as they get older, some earlier than others, of course. Now, actually, the symptoms of a benign enlargement of the prostate are very, very similar to the signs of cancerous enlargement. And these symptoms would include frequency, the need to go to the toilet more often, urgency, the need to urgently go when you feel that you've got that you need to get to the toilet as soon as possible without leakage occurring. Also, there might be blood in the urine, not often, but there might be. There may be a need to go again after you've just thought that you've emptied your bladder. And other symptoms would include some hesitancy. So when a man starts to empty his bladder, he has to wait for it to happen because the flow of urine is weaker, and it takes time to start. Equally, at the end of urinating, there might be some dribbling, so the stream doesn't stop immediately. So there might be some leakage and a little bit of incontinence. These are the commonest symptoms of prostate cancer. But often men will have prostate cancer with no symptoms at all. And that's why it's important to be aware of prostate cancer and to consider, if you're over 50, asking your doctor about the blood test that can be done to measure something called PSA, which is prostate-specific antigen, a protein only made by the prostate gland. And whilst this is helpful, it indicates if a raised level might indicate a number of things. It could indicate prostate cancer, but it can also be raised if there's a urinary infection or prostatitis, inflammation or infection of the prostate gland. So the PSA is not used as a screening test per se, but it can be done, especially in people at high risk. For example, people who have a family history of prostate cancer. Certain ethnic groups, particularly Afro-Caribbean and African men, are more likely to develop prostate cancer. So if you're at high risk, you can ask your GP even before the age of 50 about a PSA test done routinely. So I hope that answers the question about symptoms of prostate cancer. Now, Rebecca asks, is hormone and radiotherapy a good treatment option for 4.3 and a Gleason score of 7? Now, when we talk about Gleason scores, we're talking about the grading and staging of prostate cancers, whether it's spread or not. So what the multidisciplinary team tend to do when they see a patient with prostate cancer is to look at these stages of prostate cancer, how far it's spread, the size, the type of cells, and they make a decision about whether it can be treated surgically, whether the gland can be removed or treated with radiotherapy or cryotherapy or brachytherapy, various different methods of attacking the prostate cancer. Or if the cancer has spread and it's not amenable to those therapies, then obviously you've got chemotherapy and hormone therapy. Hormone therapy basically blocks the effect of testosterone, which is the male hormone which feeds the cancer cells, if you like, and chemotherapy tends to destroy those cells. So I think it's important to talk to the multidisciplinary team for that decision to be made, because it will depend on the general health of the patient, the age of the patient, the choice of the patient about which treatment they want. So I hope that answers your question. We've got an anonymous question here from, I think it's Slido. Can prostate health be determined by a blood test now? The answer is not definitively. The PSA test is the blood test that we talk about. The problem with the PSA test is it's unreliable. If it's raised, it doesn't necessarily indicate prostate cancer, because it can also be raised, as I've said, with a urinary infection, with prostatitis, inflammation or infection of the prostate gland. And even if it's normal, it can miss a cancer. So 1 in 7 men have a false negative PSA result. In other words, the PSA level is normal, but they do have an underlying cancer. So that's missed. And 3 in 4 cases of an enlarged, of a raised PSA turns out not to be cancerous. So the test has pros and cons, but there is no definitive blood test. What happens is that if we find a patient with a raised PSA, we would then advise them to have further tests, which would usually include a magnetic resonance imaging scan, an MRI test, and then possibly a biopsy based on the result of that. So there's no definitive test that will say yes or no, it's prostate cancer, but the tests are useful if used appropriately. So another question from the same person: should I be worried about shortness of breath? Well, yes, always. There are so many different causes of shortness of breath. Shortness of breath can be the result of just being out of shape, a bit unfit, overweight. Can be the result of anemia if you haven't got enough iron on board and you haven't got the ability for your red blood cells to carry oxygen around your body. It could be the result of a lung disorder, blood clots, for example, or an infection of the lung, or anything that affects the transfer of oxygen from the air that you breathe into your bloodstream. Shortness of breath can also be due to a systemic disease or disorder, including spread to the lungs of disease, of conditions elsewhere in the body. So yeah, I think if there's no obvious explanation for your shortness of breath, certainly talk to your doctor, get some tests carried out and find out what the underlying cause is so it can be treated. The next question is, does alcohol increase your chances of developing prostate cancer? Well, the evidence doesn't show any very strong link between alcohol consumption and prostate cancer. But then alcohol drunk to excess over many years increases the risk of cancer in many organs of the body, notably the stomach, the bowel, the throat, and mouth, liver, pancreas. So it's always advisable to keep alcohol consumption to within the recommended upper maximum range, 14 units per week. And bear in mind that one bottle of wine with its increased strength these days is about 9 units, and a pint of average strength beer would be about 3 units. So just bear in mind those figures, keep count and drink within those recommended limits. Next question is, what is heart failure? Heart failure sounds dramatic, doesn't it? failure of the heart, what it actually means is that the heart begins to become less efficient as a pump. So the circulation of blood, which happens as the heart is pumping, becomes a bit more sluggish, which means that the perfusion of organs and cells and tissues around the body is reduced. Oxygen supply to those tissues is reduced. So fatigue is a common symptom. But it also means that congestion can occur in the venous circulation. So blood returning to the heart isn't dealt with so quickly and efficiently. And there's a buildup of fluid in the tissues, which often affect those tissues lowest in the body. The effect of gravity doesn't help. So edema, fluid building up around the ankles, the lower legs, and sometimes in the lower abdomen, and then shortness of breath as well, as fluid can build up in the air sacs of the lungs. So that's what heart failure is. It is very common as we get older, but thankfully there's medications that can increase the pumping capacity of the heart muscle, and that can allay many of the symptoms of heart failure. Also diuretics, which get rid of excess fluid in the body. So again, if this is of concern, treatment from your doctor will almost certainly keep it managed and under control. So we have a question from Sufyan. How important is diet and nutrition in maintaining prostate health? And are there specific foods or supplements that are particularly beneficial? Well, I think it's worth saying from the outset that obesity is considered to be a risk factor for prostate cancer development. So keeping weight as normal as possible is important. And largely that means reducing our reliance on junk foods, highly processed foods, saturated fats. So cutting back on too much fatty meat, fatty cuts of meat, too much saturated fat in the form of cheese, dairy products, cutting back on sweets and junk food, fried foods, that sort of thing is important. Generally speaking, fiber, vegetables and fruits are much better for us, and that includes looking after our prostate. And in particular, lycopenes from things like tomatoes can be very beneficial. So increasing your reliance on fruit and fiber, fruit and vegetables, and cutting back on saturated fats is always going to reduce your future risk of prostate cancer. Now, Annette has a question. My husband was diagnosed with advanced prostate cancer and on hormone therapy. Can this cause fatigue? Hormone therapy, like all other therapies, can have side effects. Hormone therapy is designed to block the effect of testosterone, the main male hormone, which feeds and nourishes prostate cancer cells. So hormone therapy has that benefit, but it also has side effects, and those would include the side effects of reduced testosterone. So almost menopausal-like symptoms for a man, if you can think of it that way. So hot flushes, sweating, fatigue might be a symptom, certainly, of the hormone therapy, as well as the prostate cancer itself as it spreads. And those side effects should be explained to anybody who's undertaking that form of treatment, which can be given by tablets or by injections. So fatigue is a possibility, but probably a small price to pay for having the benefit of that treatment. Next question. And I'm so pleased these questions are coming in, because they're all very pertinent, and I just wish more people knew about prostate enlargement and prostate cancer. We always have to remember that prostate enlargement is common, and only 1 in 10 cases of prostate enlargement are going to be cancerous. 9 out of 10 are benign enlargements, which can be dealt with in different ways, and symptoms can be relieved. So this person has heard, this is Slido again, I've heard muscle mass is important in older age. Why is that? How important is it really? Well, as we get older, we lose muscle bulk, partly as a result of our hormones that keep muscle bulk going become diminished. But we suffer from something called sarcopenia. Sarco is just the Greek word for muscle. Penia means deficiency or deprivation. So muscle bulk is reduced in sarcopenia. And if you look at muscle under the microscope in an elderly person, there's less muscle fiber and more fibrous tissue. So what we know is that if we do resistance exercise, we keep the muscles stronger. There's more muscle and less fiber in the muscle. So the muscles are more flexible, they're stronger, they're more resilient, and that reduces our risk of having falls or tearing muscles. And so it's important to look after our muscle bulk and to eat plenty of protein in our diet, and to carry out resistance exercises. I think that's really important, something we should all undertake. Next question, is there a test for heart failure? Yeah, I mean, we can look at heart failure in lots of ways. We can check blood pressure. We can look for, when we examine a patient, we can look for fluid retention. We can check kidney function. We can look at an ECG, check the electrical signals in the heart. We can carry out a chest X-ray, look for fluid in the lung and the size of the heart, look for any dilatation of the heart muscle and the size of the heart chambers. So lots of tests that can check for heart failure. And that enables us to make a diagnosis and get the patient treated. So the next question, and I'm glad we have so many coming in. I mentioned lycopene, but I can't eat tomatoes. Are supplements worthwhile? Yeah, absolutely. So you have to eat quite a lot of tomatoes to get the lycopene that's going to be beneficial. Nature does provide these wonderful compounds which are protective to our health, but unfortunately, as we grow more crops and the land becomes less nutrient dense, the vegetables and the fruits that we consume tend to have less vitamins and minerals in them than they have formerly. So supplements are really useful here. So yeah, lycopene can be taken as a supplement, as can many other plant and vegetable compounds. I mean, I'm thinking now of plant sterols and stanols, which have a good effect in lowering cholesterol, for example. But it's important to choose a reputable supplement. Go to a company or a site which has a good reputation and uses evidence-based science to produce those supplements. Make sure there's a credible medical team behind those companies, and that those products are environmentally and sustainably sourced. I think that's important too. So I'm just waiting for the next question. Here it is. It's all working very nicely. We've seen advancements in testing and diagnosis for cervical screenings over the last few years. Is the same being done for detecting prostate cancer? I can't say that we're as good as we have become for detecting cervical cancer. The cervical screening campaign is really good, because when we look for cancerous cells on the cervix, we can say yes or no, there are precancerous cells or cancerous cells there. And that's why we have a national screening program. It's very effective, and there's no doubt it's saved thousands of lives. We also have a cervical cancer vaccine now. So two-pronged ways that we've enabled us to detect and treat cervical cancer, and it's making a real difference. We can't say the same about prostate cancer yet, because as I've said, the PSA test, the blood test, isn't as reliable. The problem with it is, if it's normal, it can be very reassuring for men, but a normal result doesn't exclude early prostate cancer. 1 in 7 cases of a normal result will actually have cancer within the prostate gland. So you can miss and falsely reassure. On the other hand, if you get an elevated result, it can lead on to further tests like MRIs and biopsies, which otherwise might not have been done. And therefore, the test has the capability of getting to an earlier diagnosis that wouldn't otherwise have been reached. So there are pros and cons, and that's why it's important to talk to your doctor about whether you want the test, whether you're at high risk. For example, are you overweight? Do you have a family history? In other words, did you have a brother or a father who also had prostate cancer under the age of 50? Are you of an ethnicity, an ethnic background that increases your risk? These are things that are important to know. So we're not quite there yet, but we are making progress with better biomarkers in the blood. And I think in the future, we will have a better blood test, which is much more specific and accurate. Victoria asks, at what age would men be paying attention to their prostate health? Should men be paying attention to their prostate health? Is prostate cancer prevalent in young men? The answer to that is, on the whole, prostate cancer is seen more in older men. In fact, many people might not know that most men, if they live to the age of 90, 95, will die with prostate cancer, but not of prostate cancer. In other words, they've had a slow growing prostate cancer for years and years and years, and it's not affected their lifespan, and it's not the cause of their death. It is common as men get older, but of course we do sometimes see it in younger men as well. So it's perfectly possible for any male or trans woman to ask the GP for a prostate test, a PSA, after the age of 50 on the NHS. And particularly so if they've got a family history, or if they're a certain ethnic background, or they're overweight, they've got other risk factors. I think it is important to think about your prostate as the years go by, and sometimes we see prostate cancer in younger men under the age of 50, but thankfully it's not all that common at that age. Are there new, less invasive surgical techniques available for prostate cancer? Yes, I'm very pleased to say that there are. So men have choices these days. If we detect a prostate cancer in the early stages, we can have that discussion with male patients. We can say, look, you've got an early prostate cancer. We've done the scan, we've done a biopsy, and we can see that the cells are not fast growing, they're slow growing. They're well within the capsule of the prostate gland, and they may never bother you in terms of your health, and this may never spread. And we can adopt a policy of watchful waiting. In other words, we can keep an eye on things And if the cancer starts to spread and threatens to spread beyond the prostate gland, we can deal with it then. And we do that because more invasive surgery can have side effects such as incontinence and sexual dysfunction, erectile dysfunction. The other thing we can offer is active surveillance. So we keep an eye on that prostate gland. We can do regular tests, see if the PSA level is increasing, the blood test level is increasing, and we can repeat scans appropriately. Or we can say to someone who's extremely worried, here are treatments available. So there's, as opposed to a radical prostatectomy where we take the whole of the gland out, we can offer something called high intensity focused ultrasound. There's cryotherapy, which freezes cancerous cells. You can use laser treatments to destroy cancerous cells. There's brachytherapy, where we use radiotherapy seedlings in the prostate gland. And these will have different efficacies and different side effects, but there's a wide choice to be had depending on the individual, their wishes and their desires, and the stage and grade of the prostate cancer that they have. So things are improving all the time. Are there less invasive? Yeah, I answered that one. My father is getting very forgetful. He's 80. Could it be dementia? How could I get him tested? I don't think he would want to go to the GP. Yeah, this is a tricky one. We worry about our elderly relatives, don't we? And forgetfulness is possibly a sign of cognitive decline and dementia. 80 is an age where we worry about this increasingly. I think it's worth trying to find out the extent of the forgetfulness. So we can all have memory lapses. It doesn't necessarily mean that we're developing dementia. So is the memory loss, the memory lapses frequent, and does it impinge on their life? It's normal for us to forget where we've put our car keys. What isn't normal is that we've put them in the wrong place, like the fridge. That would be more worrying. So how often is the forgetfulness occurring? Do they forget their children's names? Do they forget their names of their friends? Do they forget their telephone number, their address? Do they forget the way home if they've gone to the shops or been out in the car? These are important things that could affect their quality of life and their safety. So I would encourage your father to talk about this and to go and see the GP if you're worried, because more often than not, somebody who's aware of forgetfulness will be relieved to be told that there's a reason for it, even if it is early dementia, because then it can be assessed and treated. They can make plans for the future. They can make arrangements where the forgetfulness is managed. So they can make lists. They can get used to labeling things and have little reminders. It makes their life easier. So I can understand initial reluctance to go and talk about it and acknowledge there's a problem, but it is important for him and for you to do that. So I would encourage him to go along and go with him, if you like, for moral support to the GP and get that sorted. A simple mini mental health examination is really quite useful in finding out the extent of the problem. How can men differentiate between symptoms of benign prostate enlargement and prostate cancer? And when should they seek medical advice? This is a difficult one because the symptoms are so very similar. The prostate is a walnut-sized gland which sits at the bottom of the bladder and surrounds the water pipe through which you empty your bladder. And whether it enlarges benignly, which always occurs with age, or whether it enlarges because of a prostate growing within the gland, the symptoms are going to be similar. It's a mechanical pressure on the water pipe, the urethra, so that voiding the bladder, emptying the bladder becomes more difficult. The stream is weaker. This is common to both cancer and to benign enlargement. The need to go more often is common to both. So is urgency, the need to go urgently as soon as possible. A bit of leakage is common to both. We don't usually see blood in the urine with benign enlargement. We occasionally see it with prostate cancer. There might be sexual dysfunction with either as well. So if any of these symptoms occur, the only way to get it sorted is to go and get some tests done, which would start with the PSA test, the prostate specific antigen blood test. And if that was elevated to abnormal levels, then the patient could be referred for MRI scanning and perhaps biopsy after that. And the good news about the scanning these days is it makes unnecessary biopsies less likely. In that the biopsy is quite an invasive test and can have certain side effects and complications. So that's less likely to happen now that we have MRIs, which can decide whether a biopsy is actually necessary or not. So difficult to differentiate between the two, cancerous or benign, but there are ways of dealing with it. All symptoms should be reported to the GP and further investigated. So whilst I wait for the next question, I might just touch on mental health issues, which are very much to the fore at the moment. You know, we live in stressful times, uncertain times. You know, I think there's people have all sorts of worries, not just financial, but worries about elderly relatives, about children, about jobs, redundancies, plenty to worry about. And rather worryingly, we've seen an increase in suicides in recent times. There was a decline generally until about 2013. But since then, there's been a rise again for various reasons. And there's no doubt that men are more likely to commit suicide than women. They tend to bottle up their feelings, not talk about them and share them. And we often don't see the signs of suicidal thoughts in people who are depressed. But yeah, 3/4 of the suicides we see in this country, about 6,500, are in men, and the age group most affected are between 40 and 50. So try, if you're worried about somebody or even about yourself, try to talk about your feelings with people you trust. Don't feel guilty or shy about opening up and expressing those feelings. It really helps. You know, problem shared is a problem halved. And if you can, go and see your GP, because treatment is there and people do care, and help is available. We have a question here about AI being utilized in the diagnostic process for prostate cancer. Yes, artificial intelligence has a place in modern medicine. Not only can it be helpful in terms of diagnosis, but in treatments too. We're already using robots, for example, to get more accurate dissection of kidney tumors and in the placings of hip replacements. But in diagnosis too, this is becoming increasingly important. So we know, for example, that if we look at mammograms in women, artificial intelligence can spot very subtle changes as accurately or even more accurately than the human eye. I don't think it'll ever replace human eye diagnosis, but in conjunction with it, it will pick up more tumors than would otherwise be picked up and diagnosed. So this will almost certainly occur with MRI scanning in prostate conditions, and probably if you collate all the information about a prostate, the biopsies that occur, the scans that occur, PSA levels, AI may well be able to detect cancers more accurately than us humans without AI can do. So let's look for the future to see how it changes the course of our diagnosis and treatments. The next question is about, is it dangerous to start exercising over the age of 50 if I haven't been active at all? No, it's never dangerous to start exercising, provided you are not suffering from a medical condition that would make it so. So let's suppose that you don't have any diagnosed medical condition. You're a normal guy aged 50. I would encourage everybody to exercise on a regular basis. For me personally, it is better than any prescription medicine you could ever be given. The human body is designed to be exercised, and it works much better, both physically and mentally, if exercise is partaken. It does all sorts of things. It relieves stress, it reduces blood sugars, it reduces cholesterol, it exercises the heart in a good way, it improves the circulation, it releases feel-good hormones in the brain, the endorphins that make us feel good. It gives us a healthier appetite. It reduces people who are overweight, it reduces their weight. So there's so many benefits to exercise, and just that feeling of feel good when we've done that, it helps our joints, helps our muscles. But of course, we need to work within our fitness levels and build up gradually. So even if it's just a few minutes walk every day, building up to 30 minutes or an hour, and then increasing the resistance, perhaps by doing some resistance exercises using light weights. These are all good things to do. And, even people with medical conditions, provided it's with the advice of their doctor or physiotherapist, exercise is generally speaking, for most people, a very good thing. I've always enjoyed exercise myself. I always feel better for it. I think it's helped my health in the long run, and I would certainly miss it if I didn't do it. They say people become addicted to it, but you don't have to be too vigorous with your exercise, and you don't have to become addicted to it, but just incorporate it if you can into your general routine, and I think you'll feel a lot better for it. So the next question is, can your lungs fully recover after quitting smoking? Yeah, given time, yes. We know that smoking, cigarettes, is an important underlying cause of both lung cancer and other cancers and heart disease. And what we do know is that quitting smoking improves initially breathlessness. It improves your circulation. Immediately, carbon monoxide levels in your blood are reduced. The risk of heart attacks diminishes within a few years. The risk of lung cancer diminishes eventually, but that might take longer. That might take 20 years. But yes, you'll feel the benefits straight away. And after that initial month where people crave a cigarette, if they've quit, if they've gone cold turkey, the cravings diminish, and you can always use nicotine replacement therapy in one form or another. The benefits are tangible, they're measurable. And yeah, after 20 years, the risks of lung cancer and heart disease are around the same as a lifelong non-smoker. So if you're thinking of quitting, I hope that is evidence that you're doing the right thing, and I would encourage you to do that. Next question. My partner suffers with eczema badly. We've tried topical treatments, but it seems to have made the problem worse. We've read it could be to do with gut health. Is that true? Right, eczema. Eczema is an inflammation of the skin. And one of the driving factors, apart from allergies, is infection. So sometimes the bugs that live on all our skins can exacerbate the eczema. So it's worth thinking about antibiotics or topical antibiotics to remove any source of infection that could be making the eczema worse. Think about anything that is in contact with your skin that could be irritating it. Think about, things like clothing materials. Think about chemicals used in the house that are in contact with the skin. Obviously, air conditioning, central heating, that doesn't help. You want to keep the skin moisturized and flexible. And if the topical treatments such as moisturizers, emollients, and gentle steroid creams aren't working, obviously there are other alternatives. But you mentioned gut health. This is an interesting one. About 70% of our immunity lies with our gut health. And there's no doubt that because of our over-reliance on highly processed foods and saturated fats and other unhealthy things, our gut health could be better. But the friendly bacteria that live in our guts are responsible for our immunity largely. There's a good connection between the gut and the brain and the skin. And there's no doubt that what we eat can be expressed in how we feel and our skin. So I am an advocate of a healthy diet and supplements of prebiotics and probiotics. Probiotics are the friendly bacteria which keep pathological bacteria to a minimum. And the prebiotics are the fertilizer that feeds those friendly bacteria, if you like. So it's worth thinking about prebiotics and probiotics in natural foods like fermented foods, kefir, and yogurts, sauerkraut, but also plenty of fruit and vegetables and fiber generally is going to be good, soluble and insoluble fiber. And it may well be that you see an improvement in eczema as a result of those things. So yeah, I would certainly advise you to do that. There's been an enormously increased interest in gut health in recent years. And whilst we can't yet identify the thousands of different bacteria which live in our gut, we can't identify which particular ones we should try to increase or decrease. There's no doubt that, gut health is vital in our general immune function and well-being. When can we get you back on the on this Royal Voluntary Service broadcast, Hilary? Have you? Oh, yeah. Someone says I've been wonderful. Isn't that nice? Made my day. I hope so. I mean, I think medical information, kept in simple terms, is really important. I wish we could talk about our bodies, how they work, and our well-being, and how to look after our bodies in school, and teach children from a young age that actually we must take more responsibility for our own health, not rely on doctors and medicines. If more people took more care of their bodies, we wouldn't see so much illness, for sure. I mean, it can happen randomly through no fault of our own, but we could do a lot more. And I'd like, I suppose on my wish list, on my bucket list, would be to introduce, human health, human well-being into the school curriculum. But thank you very much for your kind words. One more question about me. You have one or two career highlights that you can share? Yeah, one of my highlights was being a single-handed doctor on Tristan da Cunha. And for those of you who don't know where that is, it's a British island, a dependency in the middle of the South Atlantic. It is the most isolated inhabited island in the world. And I went there for a year as a single-handed doctor, knowing that the ship only comes 3 times a year and stays for about a week. So when you're there, you're stuck. There's no airstrip, you're outside helicopter range, no ships other than the supply ship comes by. But it was a fantastic adventure where I had to use all of my medical skills to look after the local population. There was nobody else to help. So it was a challenge, it was adventurous. And I was young, having just done intensive care and casualty work, and feeling confident, but it really was a challenge. And I probably wouldn't do it today because it's such a responsibility, but it was a great experience. That was one of the highlights of my career. And then I think having combined general practice with TV work, TV and radio media work, has been fantastic, because in the surgery, I can talk to one person at a time, and that's important to empathize with that one person and give them the attention they need. But in the media, I can talk to, 1 million people at a time in peak viewing times, and transmit messages, which I know has been important, because we get letters at the studio saying that without the knowledge that you've just imparted, or the program's imparted, my husband wouldn't have gone to get his prostate checked. I wouldn't have gone to get my breast checked. I didn't know the symptoms, the signs of breast cancer could include puckering of the skin. I didn't know about heart disease affecting women as much as men after the menopause, that sort of thing. Meningitis, tests for meningitis and the early signs. That's been a career highlight for me, and I'm still enjoying it, and I will continue with it, and I will be very happy to come and do more of these for the Royal Voluntary Service, who do such fantastic work in all our hospitals. That they really do, and they rely on donations as well, and all their staff are wonderful, and I take my hat off to them. So we've got a couple of questions here before we wrap up soon, on hay fever, which we were talking about on the show today with Natalie Cassidy, actually, on Lorraine Kelly's show. But how do I beat it? Is it just antihistamine? And the other question was, does eating local honey work for hay fever? Great questions, because hay fever is really a high problem at the moment. The pollen count's high, and the reason for that is because we've had so much rain. The plants and the grass has grown tremendously fast, and as soon as the sun comes out, which it hasn't done much, I know, but as soon as we get a dry day, pollen is just being released into the atmosphere, particularly early in the morning, and then at dusk, as the air cools and the pollen comes out of the sky and drops again. 20% of our population get hay fever, and right now the pollen levels are very high. But antihistamines are great. Those non-sedating antihistamine tablets are good, but for some people they're not enough. It's quite useful if you've got eye symptoms, red eyes, watery eyes, itchy eyes. Anti-allergy eye drops, sodium chromoglycate, really good to help with eye symptoms, but they work over a period of time. They won't work immediately. They're there to prevent the allergy. So remember, it's a preventative treatment. Use them all the time, even if you haven't got symptoms today. And then nasal sprays, very mild, low dose cortisone. Nasal sprays can be very helpful indeed. And if you've got asthma or wheezing of any kind, then obviously you use your inhalers. Make sure you've got your acute treatment inhalers and your steroid preventer inhalers. They all help. And if you're really suffering, you can't function, then talk to your doctor about cortisone injections, which may not be available on the NHS anymore, but they can, in certain instances, be very useful. Ask about side effects. Local honey, yeah, I'm not convinced. The theory is that if you buy honey produced locally, the pollens that are incorporated into the honey via the bees who pollinate the plants will kind of desensitize you to the local pollen that's in the atmosphere from crops grown near you. The desensitizing theory is all very well. I'm not convinced, and certainly anybody with significant hay fever symptoms is not really going to benefit from local honey. And I'm sorry to say that, but that's what I believe. But honey's nice anyway, isn't it? So enjoy it for the taste. Right. Yeah. Let me think. Hay fever. Yes. So there we are. Look, we're bang on 11 nearly. 5 minutes to go, but I think we've covered a lot of ground. My final remarks about men's health would be this: guys, you're not as good as your partners, your female partners, in talking about your health or looking after yourselves. Sorry, but it's a fact. Women are much better at sharing. Guys, don't just talk about what you can talk about in the changing room at the football ground or the rugby ground. You get an injury, you're very proud of it, you'll talk about that. If you've got a problem that you might think is embarrassing, it's not embarrassing to doctors, and it's not going to be embarrassing to your partners. Talk to your partners. Talk about testicular lumps. Talk about prostate problems, bladder problems. Talk about your worries and your concerns if you're feeling stressed about your job. Talk about your relationship. Talk about erectile dysfunction. Talk about urinary problem. Talk about anything that is impinging on your health, and find out what you can do to make life better for yourself, make your well-being improved, because boy, there's so much we can do. Guys, you need to look after yourself. Don't rely on your partners, relatives and friends to do it for you. Grasp it with both hands and look after yourselves. It's been a pleasure talking to you today. I hope it's been useful, and I hope to see you all again. Take care.